Thank you, Mr. Speaker. Last spring, I asked the Health Minister a question about AHS and the patient care-based funding formula that had withdrawn resources from people with Alzheimer's and other dementia and mental health issues. To the same minister, it's Mental Health Week and it's a good time to check in again. Can you provide us an update on changes made to fix the funding formula for care centres to ensure that people with Alzheimer's and other dementia and mental health issues are adequately resourced?
The Honourable Minister of Health.
Well, thank you very much, Mr. Speaker, and it is Mental Health Week, and I thank the Honourable Member for raising a question in that regard in question period today.
Sure.
Mr. Speaker, we are involved now in a detailed review of both the policy for continuing care in Alberta and the funding formula that should be applied in order to achieve the outcomes we wish. For the group of Albertans that have dementia today, about 40,000 people across the province. They are being joined by about 8,000 of their fellow citizens each year who are being diagnosed with dementia. The funding formula must absolutely better reflect the demands that dementia poses for their care.
Thank you. For a supplemental.
Following on your participation in the UK Dementia Conference, what actions are underway by Alberta Health to develop a provincial dementia strategy? Specifically, are you working with the Alzheimer's Society or other community organizations to start work on a provincial strategy?
Honourable Minister.
Well, Mr. Speaker, both the Ministry of Health and Alberta Health Services are working with many stakeholders. There are two key areas of focus. The first, of course, is to delay the onset of dementia and other similar diseases as much as possible. And the second is to support people who are living with dementia or Alzheimer's and their families who are in many cases supporting them at home. I can tell you, for example, that we are in the midst of a 3-year grant that's been provided to the Alzheimer's Society of Alberta and the Northwest Territories to implement First Link, which connects people who are newly diagnosed with dementia and their families to information, resources.
Thank you. Final supplemental.
This question is to the Associate Minister for Seniors. Given the growing percentage of residents in care centres with dementia and associated depression or mental health issues, what steps are you taking to ensure adequate resources are being provided for the care of this population, and can we be ensured that the latest design research is being applied to the development of new care centres for this population?
Honourable Associate Minister.
Well, Mr. Speaker, yes, we can. We've built 3,000 accommodation spaces in this province in the last 3 years, and we're adding 2,000 more in the next 2 years. Virtually all of these facilities will have dementia care spaces, and there'll be more to accommodate the increasing numbers of people that are suffering from dementia in Alberta.